Hi, this is RxHelp, advice for a person on the other side of the pharmacy counter. Today I'm going to be talking about a very important drug interaction that a lot of people don't know about. I think I've only seen one public announcement about this at all, and it's a very important thing, especially for women over the age of 65. There is an interaction between some calcium supplements and some antacids. Well, not antacids, but stomach protectant products that help with acid reflux. So the interaction is between that of proton pump inhibitors like Prilosec, Nexium, Capodex, Protonics, things like that. These also go by the name of omeprazole, that's Prilosec, pantoprazole, that's Protonics. Capodex is now Dexilant. It used to be Capodex and they changed the name. That's deslansoprazole, and lansoprazole is Prevacid. But anyway, proton pump inhibitors and calcium carbonate specifically. Oscal and Caltrate are the two big ones, but calcium carbonate is the name of the supplement. And basically, the interaction between these two stops calcium from being absorbed correctly, that form of calcium. Because calcium carbonate needs acid in your stomach, it needs an acidic environment to be broken down and absorbed into your bloodstream. By taking proton pump inhibitors especially, you are stopping the acid-producing cells in your stomach from producing as much acid. Basically, then the calcium carbonate does not get broken down and doesn't get absorbed into your body. So you're not getting as much calcium as you should into your body. It is not so much known if this is also true with something called H2 receptor antagonists. That would be Pepcid, Zantac, Tagamet, those things. It's not so much known with them if that's an issue, but from what I've seen, people are also treating it as if it is an issue, just because the solution is really easy and it is known that this will definitely be absorbed. And also antacids, just your regular Maalox and Rolaids, those will bind to any calcium products. So if you're going to take an antacid because your stomach hurts, wait 2 to 4 hours before you take any calcium supplements, because that one, it doesn't matter. It binds to the calcium and kind of just makes it inactive and basically just stops it from being absorbed completely, regardless of what you're taking calcium-wise. But with Pepcid and Prilosec and Nexium and those things, the solution to that is to take calcium citrate, or Citracal is the most well-known name brand. This product contains basically vitamin C. Vitamin C is a slightly acidic compound, and it basically makes it so that your body doesn't need to provide an acidic environment. Now, this shouldn't really cause any kind of acid reflux, but it basically gives the calcium the acid component that it needs to be absorbed, and so you don't need to worry about taking it with food or not taking your acid reflux drugs. You can take them and then take your calcium and you'll be good to go and you'll get your calcium. The only issue that a lot of people have with the calcium citrate is you need to take more tablets than you would for the calcium carbonate. Usually it's around 2 to 1, sometimes 3 to 1. So you're going to be needing to take 2 to 3 more tablets of the calcium to get the calcium that you would have gotten in one tablet of the Caltrate or Oscal or calcium carbonate supplement. That's the only issue that I see people having with it. But basically that allows you to you know, get your calcium, which is extremely important for especially women over the age of 65, because it's going to help prevent any kind of bone breakage due to osteoporosis. The older we get, the more calcium is taken away from our bones, and women are more prone to this. But even as far as people my age, people middle-aged, men as well, anybody that is taking a calcium supplement, if you're also taking these acid reflux suppressant drugs, it's important that you take calcium citrate. And as always, make sure that it has vitamin D in it, because vitamin D, if you don't have that, calcium is not going to do anything, because your body needs the vitamin D to activate the calcium. So you need them both. So just make sure that you either get the calcium product that has vitamin D in it, or if it doesn't, get a vitamin D supplement. Now, if you have vitamin D issues, speak with your doctor. But this is just for your normal, healthy, average person. If you're taking Prilosec, Nexium, any of those proton pump inhibitors, especially those, you want to make sure if you're taking calcium supplement, it's calcium citrate, or Citracal is the well-known brand. If you're taking Pepsid, like I said, don't know if it's unknown if it causes the same effect, but treat it as if it does. That would be my only thought on it. Treat it as if it causes the same interaction, and just buy Citracal or calcium citrate. I don't intend to be using any name brands more than others. I do not work for any of these companies. It's just the most well-known brands that I'm using, because those are the ones that people are most likely to come across. But calcium citrate is the one that you want to use. So basically, to sum it up, if you take proton pump inhibitors such as Prilosec, Nexium, Protonix, or Dexilant, and you also take a calcium supplement, make sure that it is calcium citrate. And that is all. This is extremely important for anybody that is prone to osteoporosis. And that's really all there is on that issue, but it's an issue that isn't really covered, and it's an issue that pharmacists don't see a lot anymore, because people are able to get Prilosec and Prevacid over the counter, and of course you get your vitamins over the counter. So it's an issue that pharmacists don't come across. It's an issue that a lot of doctors don't think to bring up or don't know about. So I feel that it's important that it be said, and that people realize there is a problem between them. So, in short, just be careful with your calcium supplements and your acid reflux suppressant drugs. If you have any further questions, contact me, or, of course, ask your pharmacist, ask your physician, ask whatever healthcare professional you choose. Pharmacist is most likely to know about this, though, so I would suggest talking to them if you go to pick up medication for calcium or acid reflux. So that is all I have for today. And any questions, any issues you want me to handle, or questions, just feel free to contact me, and I can either help you or tell you where you can get the help. Okay, I hope I helped you today. Have a good day, everybody. Bye.